What is really important to us as cochlear implant users is interdisciplinary collaborative team care. There are many providers under this umbrella, but all with one goal, and that is success and satisfaction with our cochlear implants. And many of the speakers have already addressed how rehab services are so critical from the outset as a core provision of our being implanted. We also want rehab services over time, something to be revisited to improve and fine tune our listening performance and optimize our comfort, since our hearing needs can evolve over time. Audiologist visits, I think Connie mentioned what came up in the first year. We would want 4 to 6 at a minimum, years 2 to 5, 2 to 3 visits annually, and then year 6 and beyond, an annual visit at a minimum for the lifetime of our cochlear implants to be able to check for our device health and technology and monitor progress. And then something else that came up was access to an ear, nose, throat doctor with a cochlear implant specialty background to be able to check physically those implanted devices in our bodies. And then for us to be able to be seen should we have changes with pain and infection or unexpected issues that arise. And then finally, cochlear implant manufacturer support is important for ongoing training with our processors, our accessories, all the assistive listening devices that can support that ever evolving journey. And then also falling under that team care umbrella would be access to bilateral CIs when that's appropriate. We talked about young children being implanted and them aging out after 30 or 40 years of use and perhaps requiring new implants. And then support for us as we become more senior users, finding ourselves perhaps in assisted living or retirement communities. We might need somebody there to help us maintain and look after our equipment. Thank you, Kaz. Next slide. We also feel that person-centered care is so critical because one size does not fit all. We need providers who are responsive to our individual needs, practitioners who ask about our personal goals and preferences for each appointment versus the preset standards that they might have for mappings and targets. Basically, we want to have a voice in our care. We want the choice and freedom to be able to switch centers or teams for ongoing care, especially if we're dissatisfied with the quality of care and service. Flexibility is important. If our surgeon retires and leaves us at a center with a new physician, we would like to be able to work with someone we're comfortable with. We also want flexibility in scheduling our appointments, convenient to times that work for us versus blindly or randomly assigned by a clinic. What we're really after is a collaborative relationship. Convenience is important. I think we mentioned proximity to our homes so that we're not traveling long distances. And virtual appointments for remote mappings would be really preferable in the long haul. And then finally, emergency care. When those situations arise, we want to be able to be seen quickly so that we're not left unable to function without the use of our devices. Thanks, Kaz. Continued care is critical also because we're so dependent on those devices for everyday communication and functioning. And that's why it's imperative we have assurances that will back our implants over the lifetime for their reliability. And it sort of fits under that umbrella of the interdisciplinary team approach as well, because it's critical that we know what provider to contact for what need we're having. Do I see an audiologist or do I return to the cochlear implant manufacturer? What's normal for my hearing change over time? Do I need to be remapped or do I need to contact that implant provider for further assistance? We all know that technology can be temperamental. So we need opportunities to revisit those accessories and assisted listening devices. Our needs are changing over time. They're not static. So are there new accessories that have come out on the market that weren't released yet when we were first implanted? And how has the technology been changing? Then we know that equipment can break down with failures and we can need repairs. So that's when we need quick access to hardware support We need to be able to stay current with costs and coverages for replacement parts that others have already mentioned, batteries that age, chargers that need replaced, coils, cables, filters. These are all part of our regular maintenance. And then emergency coverage and tech support. I was only part of a clinic that had one processor. So what do I do? What do others do if we need a backup processor? Is it even possible to get one? Do we have to pay out of pocket for it? And then support and training by the implant manufacturers speaks to our desire for hearing health literacy and education. It can feel overwhelming early on when we're introduced to all the technology, the apps, and how to connect. So we need quick support for basic device troubleshooting. We need access to user-friendly training materials, maybe even hands-on support, especially for senior users who might not have the sight or dexterity to be able to figure their way through lots of reading material. We want materials that will be able to support us to continue being involved in our own care and be able to self-advocate. And then finally comes upgrades to our equipment. When are we eligible? What's the process for getting an upgrade? Will insurance cover it? Is there access to funding? Thank you, Kaz. So finally, it takes a whole village in the name of support services, which goes back to a collaborative team approach. Because hearing loss is also an emotional journey, we want access to counseling services, professionals who can help us journey through the grief that some of us experience with the result of our loss. It's not only physical and emotional loss, but it comes with an increased cognitive load with the listening fatigue. So counselors and therapists could offer us support in that regard as well. And finally, we want support in navigating those different social and relational spaces, whether it's at home or at work or recreationally. Each environment comes with its own unique set of challenges. So to have support people coach us through those different environments would position us for better success and re-entry on this side of our hearing loss. And finally, those peer support opportunities others have mentioned would offer us healing within community so that we're not shouldering this experience alone. We want to be able to glean strategies for success from others who are walking a similar journey, and there's strength in numbers. So this too would increase our ability to continue growing in self-advocacy and enabling us to have that strong voice in our own hearing care.